Welcome everyone. I'm Karen Richardson. I'm going to be talking to you today about the anatomical changes that occur during pregnancy. Now, as pregnancy goes on, we have a lot of obvious changes that are taking place to mom. There's an increase in size. We're going to have personality changes. We're going to have all kind of variety of things that happen at each stage. As this fetus is developing, it's putting a lot of demands on the woman's body. All the organ systems will be involved. They will all show changes, and we will have a lot of different side effects and symptoms at each stage. Now, the very first thing that most women notice is morning sickness. They become sick in the morning. And the reason is that we have rising levels of hormones. The estrogen and progesterone levels are rising all throughout the pregnancy, especially in the morning times. This is when we're going to have the higher levels, so that's why it tends to be when the woman first wakes up. At the moment of conception, fertilization, is where our chart is going to be starting. So when the embryo implants, it begins to release human chorionic gonadotropin, or HCG. And this is what a pregnancy test is looking for. If there is HCG in the urine, then that's a sign that the woman is pregnant. Now, HCG is responsible for signaling the corpus luteum. Corpus luteum is that cluster of follicular cells that are remaining back in the ovary from where the egg originally came from. So HCG tells that corpus luteum to keep making estrogen and progesterone for a little while. And it will do this up until about here. Around 3 months, the placenta is large enough and developed enough to be able to take over the responsibility, and it will start producing the progesterone and estrogen. Now, as we proceed, these rising levels of estrogen are going to trigger the release of prolactin. From learning about endocrine system, you learned that prolactin was a hormone produced in the anterior pituitary gland, and we normally don't release this. We're actually going to inhibit the release of this hormone until pregnancy, and then these rising levels of estrogen are going to trigger the release of more and more prolactin as the pregnancy develops. So you're going to see this increase in size of the breast tissue. Prolactin targets breast cells only. It's going to cause the development of the mammary glands. It's going to cause increase in size and milk production. So we're going to have some hormonal changes that are taking place all throughout the pregnancy. Now, during the latter part of the pregnancy, we're going to get another hormone called relaxin, which is going to affect ligaments and cartilage. It's going to cause them to become more flexible, to become wider. In essence, we're trying to help matters during childbirth. The head of the fetus has to go through this pelvic outlet. And if you remember from the bones, you learned about the pubic symphysis. This is a cartilage that's normally found between the pubic bones, and it allows a little bit of movement of our hips as we walk. Well, thanks to this hormone, this cartilage is going to get wider and more flexible toward the end of the third trimester. And this is going to allow the hips to spread just a little bit more to allow for childbirth. It's also going to cause some women to have a little bit of a waddling gait because their hips are literally more flexible at this point. Another skeletal change will be this increased curvature in the lower back. We call this lordosis. This is where the increasing weight of the baby is changing the woman's center of gravity. She's literally has a tendency to want to tilt forward. So to compensate for that, your back is going to tilt backwards. We're going to have this increased curvature that helps keep the woman upright. Obviously, over time, if this is pronounced enough, we can get lower back pain. And that can be one of the side effects of this. And again, we say that this is temporary because once the baby's born, hopefully mom will go back to her normal curvature. Now, the uterus is going to make some dramatic changes. We start from roughly about 3 inches in length to large enough to reach the sternum here at the xiphoid process. The uterus is found deep within the pelvic cavity. It is tilted forward. This part right here at the superior anterior is the fundus. This is the part that we're going to pay attention to as it grows. The fundus will eventually reach the xiphoid process. Now, one of the common measures that they take during exams when mom goes in to get checked each month, they're going to measure from the pubic bone to the fundus. They're going to feel for the edge of the fundus and take this measurement. They're going to literally take a measuring tape and measure. And they found that there's a correlation between the number of weeks and the centimeters. So a woman who's roughly at 22 weeks should measure 20 to 24 centimeters from the fundus to the pubic bone. So it's one way of judging the growth of the fetus and estimating about how far along a woman actually is. Now, one of the more interesting changes that we have is with our skin. This here, this dark vertical line, is the linea nigra, or the brown line. It is literally a stripe that will appear toward the end of the pregnancy in about 3/4 of all pregnancies. Usually it's darker skinned women that will have this. It's due to this melanocyte stimulating hormone made by the placenta. An old wives' tale says that if you have this line extending from the pubic bone all the way up to the sternum, then it's a boy. And some said that if you only have it going part of the way, it would be a girl. I don't know how true that is, but wives' tales had lots of ways to tell before we had ultrasounds. MSH is also causing some other effects. The areolas that surround the nipples will turn darker brown. Some women develop something called cholasma or melasma. It goes by, has two different names. These are the brown spots that will appear on the face. It's most common on the face, but you can see it on other parts of the body. But these usually fade. Some women, they don't. This is one of the side effects in the skin. Another really common side effect in the skin are stretch marks, stria gravidarum. They're typically found, of course, in the abdomen and in the breasts. They are this reddish, purplish, pinkish stretch mark. Now, they're due to a literal tearing of the dermis as the skin stretches. So if you have rapid growth during the later weeks of pregnancy, then the skin will literally stretch in these areas and tear, and you get these stretch marks. Now, some women, they will fade slightly. They'll turn lighter brown. Most of the time, they never completely go away. This is literally scarring of the tissue. Lubricating, moisturizing the skin during pregnancy is always a good idea. Helps limit or lower the chances. And high numbers of women tend to have stretch marks. Usually you can look at your mom, female members in your family, to see if it's likely that it runs in your family, whether or not you will. Now, this is the question a lot of women don't like to think about. Where are all the abdominal organs? As the baby's getting larger and larger, I talked to you about how the fundus is reaching all the way up to the sternum. The baby is obviously pushing outward and upward. That's easy to see. But the internal organs are back here, and they're getting squished up against the spine. They're also going to be pushing up against the diaphragm and the ribs. So the ribs will actually flare out slightly. The diaphragm will be pushed superiorly. The heart is actually moved slightly up. So you can tell what that's going to be doing to all your internal organs. So mom's stomach is getting pressed. It's going to limit the amount of space in the stomach. So you're going to get some heartburn, some indigestion that's caused by the displaced stomach and esophagus. So mom's going to have a little uncomfort there. Now, all of these intestines are also being displaced, pushed upward and back. So it's going to slow down the movement of the food through the intestines. Now, normally, we actually do this on purpose. We will have hormones that will cause the motility to slow down. And we do that because mom needs to absorb as much food as possible. We need to get as much nutrients in. But one of the side effects of this is constipation. So pregnant mom is going to have a little bit more trouble moving the feces through the bowels. So some advice would be to drink more fluids, eat more fibers in the diet, try to offset that problem. Now, one obvious problem with pregnancy is increased trips to the bathroom. And if you understand your anatomy and you look at this picture, you see that the weight of the baby is pressing down against this poor little bladder. And the pubic bone right here is not going to move. It is immovable bone. So as the bladder tries to fill up, we have this weight of the baby pushing down. So it's going to increase frequency of trips to the bathroom. Also, mom's bloodstream. She's going to have more blood volume to send blood to the baby. So this increased blood volume is putting more work on her kidneys. she's filtering more blood, she's producing more urine, so she has more urine to void. So she's going to increase the number of trips simply because there's more urine being produced. There's also a possibility of incontinence, and this occurs toward the later end of the pregnancy. Sometimes mom can't control when she voids, so she's going to have problems holding her bladder. Now, one of the major changes is changes in your bloodstream, your cardiovascular system. Sometimes women are told that they have a rosy glow or they appear very beautiful because they're flushed. Some of that may be that they're just very hot. They're carrying around all this extra weight. But we are literally increasing the amount of blood that we have. We've got to have more blood to go to the baby. So if you go back and you think about cardiac output, we've got to increase the amount of blood that we circulate. We're pushing more blood. We've got to send that blood to the placenta, to the baby. So we need to increase everything. So we're going to increase stroke volume by increasing our blood volume. So the more blood we have, the more we're putting out with each heartbeat, the higher our cardiac output goes. We can also notice that if we increase the heart rate, if heart rate goes up, we also increase what the heart puts out. So if you look at a graph of a typical average pregnant woman, her heart rate's going to increase over the pregnancy. And again, all of this is to increase blood flow needed by the baby. Baby's got to have oxygen and nutrients, and he's also got to have waste products being removed. So we have definitely increased the work of the heart for mom. And another reason that we want more blood volume is actually a fail-safe. It provides a little bit of safety feature in case mom loses blood during childbirth. We have a little extra that we could afford to lose. And this picture here is a beautiful graphic of a large fetus right before childbirth. We see the placenta delivering blood and taking away waste products. But this is a very obvious problem. I already told you about how all these internal organs are getting compressed up in here. We've also got two very large blood vessels that run along right back here at the base of the, anterior to the spine. Enlarging fetus is going to be putting pressure on those two. So if you see a very advanced pregnancy, that woman should not be laying on her back because the pressure of the fetus is going to be putting extra pressure, collapsing those blood vessels. So the heart's going to have to be working harder to pump arterial blood. We're going to have a harder time getting venous blood back up that inferior vena cava, the IVC. So typically it's much better for a woman in advanced stages to sleep on her side or lie on her side. It's not going to be putting that pressure on these blood vessels. Now some of the other problems that we see because of this are varicose veins. If we can't get the blood back up as easily, blood will tend to pool in the legs, in the veins of the lower legs. So we're going to see fluids leaking out into the tissues, and we're going to see some of the veins will distend, giving us varicose veins. Now we can also see hemorrhoids in the anal region. These are distended veins, and the constipation can add to this problem as well. Now edema is also a result. If all this fluid is leaking out into the tissues, you're going to see a woman who has very swollen ankles and feet. And a lot of women during the later stages of pregnancy simply can't wear their shoes anymore. They're so swollen. Now, one of the things that most women worry about during pregnancy is how much weight they're going to gain. Well, this can vary. Typical, you're going to see anywhere from 28 to 30 pounds for pregnancy. But you have to think about mom before she became pregnant. Was she underweight to start with, or was she overweight to start with? So it's very hard to say exactly how much weight any woman will gain. So it depends on her nutritional habits, her exercise habits, and how she started. The sad fact is that you only need to intake about 300 extra calories for the developing baby. Those calories need to be more nutritious foods. It doesn't need to be donuts and candy, right? So it needs to be vitamins, proteins, foods that the body is going to need. So if you break this down, the average baby is anywhere from 5 to 10 pounds. So obviously all of this is not baby. So if you look here, we have a 7.5 pound baby. The uterus itself, I told you how dramatic the uterus increase is. The smooth muscle is drastically changing. So it's going to weigh roughly 2.5 pounds. The amniotic fluid that surrounds and cushions the baby in the uterus, it's going to have a certain weight, roughly a couple of pounds. The placenta, this is what's being produced, the connection between baby and mom, about a pound. This is going to be the afterbirth that comes out after the baby. The breasts are going to enlarge. Depending on the woman, you can get anywhere from 1 to 3 pounds of extra weight. The blood itself, we've increased blood volume. Average of 4 pounds just all this extra blood that mom is pumping through her system. And retention fluid, of course, can vary greatly between women. Some women will not retain much fluid at all. Others will become very swollen, especially in their lower legs and ankles. So all of this is going to vary between women. But all in all, weight gain is made up of a lot of different parts. So as you learn about pregnancy and the reproductive system, you're going to find out that it's truly a beautiful miracle. Moms go through a lot to have a baby. Some of these changes fade, go away. Some of them do not. But all in all, you end up with a beautiful baby, and it is usually the best experience. I know it was the best experience of my life. So thank you for listening, and I hope you enjoyed hearing about what happens to mom.